Before we start, you guys can discuss so people can take advantage of whatever the discussion you have. So please go ahead and then we officially start.
So Dr. Zameer, you were saying you remember the AIDS epidemic?
Oh, you're muted, Dr. Zameer.
They have this, don't feel anything, right? 50% of them, they don't even know they have it. And that's the worst thing for community, how they're spreading it. Because at least you have a runny nose, stuffy nose, you have a cough, you can say, okay, I gotta be careful. Here we're seeing the community member who really have no symptoms. They work in Manhattan or they work in, front line. So it's so many stories, which is just so tough that will drain us. And then what other happens is, I have almost like 100 patients a day I'm supervising right now. So in that population, you see patient coming in, very healthy looking, oxygen okay, breathing okay. They tell you, doc, I just have a little cough, a little short of breath. And then 2 days, 3 days later, just on a ventilator, just like that. It's progress.
It's really amazing.
Yeah, it's amazing how fast it's just taking people away. And you can't predict, and we ourselves are surprised with it. And family who cannot come to the hospital, cannot visit their loved one, they just surprised. They say, what happened? He was going to the hospital with a little fever, mild cough. What happened? He comes in dead. But that's 72 hours, 3 days, 4 days. It's just devastating. And of course, this is a very small population. It is, 2%, 1% population. But that 1 or 2% population going that fast, people compare with influenza. They say, well, we've seen so many deaths with influenza. But that influenza death is over a period of time. And the hospital don't get bombarded with, 200 cases at one time. Here we have, in JFK, we have almost 170 to 200 people with the virus positive, and maybe about 100 of them on ventilator. It's just amazing, and how devastating it is for the community. We change our whole cardiac rehab unit into COVID ICU unit. There's huge beds, and we have 10, 15 patients just in the huge area created a negative pressure room. And it's devastating looking at those people, and your hands are tied because you can't do anything. You keep changing the ventilator, you keep doing almost, sorry to say that, voodoo medicine on these people because nothing is being effective. So I think we're doing our best. Nancy, if you remember AIDS time in 1987, 1988, we have only one medicine called AZT, didn't work on anybody. So I seen 22, 23, 25 years old. Young people, I was working in University Hospital, knew at that time. So they're just coming in, they're just dying, and within weeks. But this virus is killing you within a week, 10 days. You get admitted, either within 2 weeks, you're going to get better, or you just die.
Well, I think it's way more contagious than AIDS in the sense that AIDS was direct physical contact, where this is not.
Exactly. So a point came, initial day of AIDS, we did not know how it spread. Initial days, when it started, people were just scared. It was scared that how it's going to get to you and you're just going to die. This virus is so contagious, as you said. It's just your own colleagues, your own people around. When you finish with the patient, they're COVID patient, you go in with all the masks, your protective gear. When you go see the patient, you come out your nursing station, you take your gears off. But here, you cannot take your gears off because your own colleague carries it. The nurses, doctors,
it's really terrible. Yeah.
So there's a mask you are using today. Today, when I came out of JFK hospital, my nose, this part was all bruised at time, really. So I had to use cold water, put it and within 2 hours or so, I think it got better. But it was not like AIDS time. It was a little different. I have protective gear, go into the room, come out, we take it out. Here we are whole day walking in the hospital, very protective gear, and hospital poor administration is cleaning everything. They're cleaning the doors of your elevators. The doors are open in a closed unit, and bathroom tabs are being cleaned, and you name it. Everything where you touch in the hospital, you have to cleanse it with antiviral things. And tough time. I think our country, the world, the community, everybody going through tough time. Yeah.
It's difficult, not to mention the financial implications, but it's very difficult for sure. So many people dying, just so many.
Yeah.
Ma'am, I'm just going to jump in and say Deborah from the governor's office was, she said she was waiting to be let in. So I didn't mean to cut off that discussion.
No, that's
All
okay.
right.
That's
So
okay.
Shanti, how are you doing? Are you going to New York these days?
I am not. The courts, the court shut down a month ago. So I'm working from home. And I actually feel like I'm working harder because right now, besides, we have 2 courtrooms. We went from 50 courtrooms to having 2. And right now my boss made me the person coordinating those 2 courtrooms. So we have 100 and almost 50 lawyers, and 110 of them practice in Supreme Court, and they're all trying to get into court before a judge to try to get their clients released, because we still have thousands of people sitting in Rikers Island, and it's just a breeding ground for the virus, and they're quite frankly, they're all just sitting ducks right now. So everybody's trying to balance this issue of public safety, right, and the safety of people who are sitting there, many of whom haven't been convicted of crimes yet, right? So they're not sentenced prisoners. They're all waiting for their day in court, and we're trying to get them out of jail. So I spend every minute of during the daytime trying to coordinate all of those cases.
Well, have they said, like at Rikers, how much of the disease is spreading there? Is that
it's spreading quite a bit, and even in areas where they're quarantining people, they are, you can hear what what the district attorney's office and what the prison is saying versus the reality of what we're hearing from the clients when they call us. They are in really terrible situations. They've had people who've tested positive, they get taken away for 5 or 6 days, and then they get brought back.
Now, are they going to, what happens when they're getting really ill? Are they going to a hospital, or they're being hospitalized there?
It depends. It depends on the stage of their illness. There's a infirmary on Rikers, and some of them are going there, and then the rest are being taken to city hospitals. But, well, it's basically Bellevue, because there's a prison ward at Bellevue.
I mean, I can't imagine that they can't be on ventilators at the prison, I would think.
You know what? We haven't even been able to figure that out. But you also have to imagine that even if they get taken to Bellevue, they're all handcuffed. So they're going through everything, and they're suffering through the disease, and they're also handcuffed to their beds. It's been very traumatic. And we have a lot of people there who have pre-existing conditions. And we're being told right now, well, unless they're, in dire situations, we're not going to get their release. So we've had people who are positive, and they say, well, they're not symptomatic. People who are symptomatic, they say, well, they're not so sick yet. So, and then at night I'm coming back, and we're doing the freeholder meetings. So we have freeholder meetings every, working meetings, just like going through, the plans for the county every night. So, so.
It is trying. I know I feel like that. Like, well, listen, we're not in the hospital, so we don't have it that bad. But
yeah, Dr. Zameer's in the hot seat.
But I do feel like everybody's talking about sitting around binge watching TV. I would be like, I would love to have that time to be.
I haven't done it yet. So.
Yeah, I said, if somebody's bored, just walk with me, just 2 hours.
Oh.
They will say it's a luxury to sit home. Absolutely.
Actually, my mother's here. I'm sheltering with my mother, and she's 75, and she says it's not that she's not empathetic, but she's just like, all they're asking us to do is stay home, right? the rest of us, right? While everybody else is battling in a war. So
it's true. So true.
So
Hello?
I think part of the problem is that, which I come back and tell my family, if somebody goes in the hospital and see this patient, what they're going through, they will really realize that how tragic it is. Even though I watch TV, they tell, well, so many people died, this is happening, it's a devastating disease. But until you see people just leaving us, going through that 3-4 days of their life, 5 days ago, they were just almost normal. Then it shakes you up. Then it tells you what is going on out there and how people breaking the law, going out, and how people don't realize that how important it is that they have to isolate themselves. It is tough to, I think media and journalists also have a tough time how much to expose and how much to say to people. Because one day they have to open up the economy and the cities, and then they will have hard time who gonna stay home and not to come out. So it's we have to balance that.
As also for the journalists, I'm saying, you know what happened, their responsibility. Because personally I had gone through with Corona. So people need the positive news. I remember when one day I was very hard me for breathing, and same day I heard the news about my community leader, 59 years old, 6 years older than me, passed away while he was sleeping. At night, I was thinking I will die tonight because I don't have the positive news at that time.
Assalamu alaikum, Mahviz bhai. Okay, please welcome all of you. I think it's time to start. People have been waiting. We have a little difficulties. This is the first time we're trying to do the webinar. And I think because of the COVID, in a few months, coming months, we will be able to learn more about online and doing stuff in online. The stuff you all know, we're having an economic crisis. It's not only the economic crisis, but also the living situation with the people who lost their job and the people who lost their family members. And there's a stigma, there's a threat, and people are scared what will happen to them tomorrow. What's happening that today, maybe I'm not positive, but let's say if I take a 3 weeks break and stay home, what will happen after 4 weeks? What's going to happen tomorrow? The numbers is growing every single day. Now we are above 600,000 people, which is a positive, corona positive. But the problem is, if I'm going to share my story within my family, they have 8 members, they already have a positive, but they did not go to the doctor's offices. They are treating themselves at home. So what happened when all of these people, they start going home, the government is maybe trying to push to everybody go back in the 1st or 2nd week of May. So these are the concerns, these are the questions, the purpose of this webinar, so we can share our experiences, we can share what people wants to know, what are the economic crises, where they're gonna feed their babies, where they're gonna pay their rent, what's gonna happen. We have in our panel, as you get different community member, the government representative, they can share what they can offer to the community in this in the situation they really need it. So I'm gonna start with Deborah. She's a deputy chief in the community affairs with the governor's Phil Murphy. Governor is doing an excellent job and he's trying to reach out to the community. And I will ask Deborah to share her view, please.
Good evening, Sam. Are you able to hear me okay?
Yes, we can hear you.
Wonderful. Good evening, Sam. Thank you so much for doing this evening. And I'm honored to be with Dr. Zameer, my Assemblywoman, Nancy Pinkin, Shanti, and others. We're so grateful. And thank you, Shanti, for getting me in. So I will take a few minutes at the top to lay out kind of our broad strategy and position. And then I look forward to hearing from the others on this panel, who I'm sure will help round out the picture. First, on behalf of Governor Murphy, we want to send our gratitude for all that all of you are doing. There are so many of you who are in the medical professional field right now, who are serving on the front lines, and so many more who have done such tremendous community service to support those on the front line. We see signs of your generosity across the state of New Jersey. We take great pride in being a diverse state and in celebrating the diversity and in getting through this together. And in so many instances where we've seen donations of PPE, volunteer medical people stepping up and serving, it's really heartwarming to see us all come together in this crisis, and Governor Murphy recognizes it, he sees it, and he thanks you. Our primary goal right now is to save lives, and that is definitely not an easy thing to do, as I'm sure Dr. Zameer will be able to speak to from the front lines, but it's all of our responsibility to support every action needed and necessary to give our healthcare professionals, our hospitals, every opportunity to do everything they can for every patient who requires medical care. And so for most of us, that means that we need to stay home, as the governor put forth in his Executive Order 107 and did additional follow-up executive orders to clarify and make some further restrictions. Very briefly, it means that with a few exceptions, we should all be staying home. If we can work from home, we must work from home. If we need to go out for essentials, medicine, visiting family members who are sick or who need care, grocery shopping, those things are allowed. There is no curfew per se, because if we're not going out for those essential reasons, we should be home whether it's day or night. And we recognize that many people who are professionals who are working from home are also now full-time teachers for their children. And that is a new and special role, which can be very, very difficult. So we know that there are challenges here. We also know that many people are staying home, not able to work from home, and they are out of work. And to Sam's point, that's caused tremendous economic hardship I'll touch on in a few minutes. Essential businesses are allowed to stay open. The grocery stores, the pharmacies, and other businesses that we've deemed essential are allowed to stay open. They have to observe, as the executive order last week put forth, safe social distancing. We're requiring everybody who goes into those businesses to wear masks, as well as the employees. And we put a number of restrictions in place in terms of how full a place can get, how many people you can let in order to protect public health of both the employees and the customers who are coming in to use those businesses. Non-essential businesses are closed to the public, and that is an important distinction, because there are some businesses that are able to serve and fulfill some function at some level of their businesses while being closed to the public. So for example, a bike store cannot sell bikes and be open to the public. They can do bike repairs if they need to. And that's the same, the same for restaurants that are allowed to be open. You can't go in and sit down and have a meal there, but they are certainly doing lots of takeout and lots of delivery and pickup. And we encourage that, because obviously the more that we can keep functioning, as long as it's done safely, is a benefit to everybody that is served and everybody who is working and our economy as a whole. Non-retail businesses such as manufacturing and distribution are also allowed to stay open, and there are some very clear and prescribed safety measures they must be taking. And if they are not adhering to those, which includes frequent cleaning, providing of PPE, the masks and gloves, we do have tools in order to enforce it. And there is a report mechanism on covid19.nj.gov where all violations are reported, and we follow up with the local health department, local police, and if necessary, the state police. We take this very, very seriously. It's also true that the governor has taken additional steps, such as closing state and county parks. That was not something that was done lightly, nor was it done with any joy. It was done because after seeing a few weekends of good weather, and even weekdays, to be frank, with so many people home, and to see the crowding that was taking place in those spots, we deemed it necessary to take the precaution to be stricter now to protect life and public health, and to be able to reopen later when we know it is safe. It is, again, not something that we like to do. The governor has always encouraged people to get outside and move around, to not be cooped up all day if it's possible. And many municipalities do have their parks still open. We ask that if they do, you use your own municipality's parks and not go to the next town over, because that town will then have to close theirs from getting too crowded. There are many other restrictions and actions that we've taken in order to protect public health, many of which have been surrounding the need to have additional healthcare professionals come into service. So we have volunteers. We have nearly now 20,000, I believe, volunteers who have signed up that we're working on deploying across the state. We've set up 3 field hospitals in the Meadowlands, in Edison, and in Atlantic City. And we are working very hard to secure necessary PPE and ventilators for all of the hospitals. all of this is being done in an attempt to flatten the curve, what we refer to as flattening the curve. We know that we continue to have many positive diagnoses as we are still slowly testing everybody who's symptomatic. There are still many people who show symptoms who may not be getting tested, and many people who may have this virus who are not showing substantial symptoms and therefore not getting tested. That's not ideal, but it's the fact of where we're at right now, given the access and availability of testing. And so we know that as the number of people who are diagnosed continues to increase and the number of people who require hospitalization, we have to do everything possible to help them get better, to give the hospitals the space to get better. And that's why we have been, as the governor has seen and spoken to on his daily press conferences, successfully flattening the curve. Commissioner Persicelli, the Commissioner of Health, spoke today that she does believe in North Jersey we've probably seen the peak. That doesn't mean that the numbers begin to go down. That means they will not be increasing at the same rapid rate at which they were increasing before. And that's a really important distinction when we talk about flattening the curve. It doesn't mean that the numbers still won't be going up. It means the rate of increase is slow enough that we believe that we're providing adequate time for healthcare professionals to do the job they need for every patient requiring care. Central and South Jersey probably still haven't seen the peak. And so we are still in for a few more weeks of what the governor describes as really tough times. And so, you know, for the continuation, the duration of April and now into at least the middle of May, schools will remain closed. Learning at home is something that we're all getting used to. And I want to put a big shout out for our educators who have adapted to that, to our students who are adapting to it, and to our parents who are now also providing instruction. But the governor has made it clear that we will not reopen schools until it is deemed medically safe and until we have the kind of testing regimen in place that will allow us to quickly test everybody who needs it in order to contain a spread of a very contagious virus for which there is no vaccine right now. We have lots of good things in the works. We have hopes from the Rutgers test that's come out that we will have access to faster testing. It's being started use in Middlesex County. And those types of things, if they can be brought up to scale, will be game changers in the way we fight this. But for now, we all have to do our part. We all have to stay home. We have to be patient. We have to find new ways to be in touch, to stay connected. We have to find new ways to worship. And we know that with Ramadan coming up, that will be a particular challenge to change many of the traditions that are held dear. But we're going to have to figure this out together. Become experts at Zoom, for example, Sam, so that we all know how we can stay connected even when we're not physically together. And I will say that we take an immense pride in standing up all of the good work and the collaboration and the partnership that we've seen across the state, and we remain confident that together we will get there. Sometimes people feel powerless in this. They don't know what to do. And what we like to tell people is that the choice you're making to stay home and adhere to these restrictions is a very powerful choice that saves lives every single day. So we ask for your continued cooperation and understanding. We offer our accessibility to answer any question. There are lots of questions around interpretation of construction, what can go on and what can't, where can I go, where can't I go. We are here to clarify and help everybody understand it. And we're also here to provide explanations for things that you may not like and you may not ultimately agree with, but at least if you can understand where our thought processes are coming from, you can help us support it. So Sam, you have a lot of wonderful speakers. I don't want to take up too much more time unless there's anything else you want me to cover right now, but I'll stay on and be available to answer any questions.
Yes, we will bring you in later on. Let's take, there's a few other people. Mahviz Bhai, are you available? Okay, so I'm gonna, because he has to go to another thing. Mahviz Siddiqui is one of our journalists from New York. He covers Dunia TV, which is a very well-known Pakistani TV, which not only runs in the USA, but around the globe. And he is the chief editor and chief in New York City. So, but why I bring him, not only on the basis of journalism, but I bring him since his work within the community and as a journalist, as a community activist, he was going to hospital, meeting people, giving away some rations, giving away groceries to the people. Unluckily, he got positive with Corona. So I request him to join us and share his experience and how he got over with this. Please, Mahviz Bhai.
Yes, thank you very much. Actually, when the government asked everyone to quarantine yourself, but my job was to inform the people and also serve the people. I'm a social worker. So I was everywhere and I was trying to protect myself with the gloves and mask. But I was in Elmer's hospital, I was in graveyard, I was in funeral homes. I will distribute grocery. I mean, even door to door on a street. I was feeding the people, the homeless people. So somehow like 3 weeks ago, you know, I'm living with my brother in these days. So my sister-in-law got a problem and we called 911 because she has the bleeding and she had all the symptoms. So we took her to the hospital.
Mahviz bhai, we can't hear you now.
Mahviz, can you raise your volume, please?
Yeah, can you hear me now?
Yes, better.
Yeah. So we took her to the Jamaica hospital, and after 5 hours, they say you have a corona, but we cannot test you, and you should go home and call your doctor because your oxygen is good. So the next day when I woke up, with a 102 or 3 fever. Then I realized I got because I have the hospital experience. So I was never tested, but all the symptoms like was a body pain, the sense of smell totally gone. I can't taste any food. So then I called my 2 doctors, Dr. Batul, Dr. Ejaz. Then they asked me to stay home because now you're positive. You should go outside. You don't have to test it because if you go to the hospital, and I think hospital did the best thing. They teach me, don't go. And now still the mayor office is advising us if you have any problem, unless you have like a breathing problem or you can't speak and you can talk, then you should come to the hospital. So I call the number, is just provided by state, and 3 weeks ago, but I never received the call until today. Today I received the call for my test day. Tomorrow I have a test. But alhamdulillah, so what my experience is, I use like, the remedies, herbal medicines, olive oil, and also I used to use steam. And also I talked to the doctor. They asked me to take some medicine, especially Tylenol, every 4 hours, 1000 mg, 500 mg, and also Zithromax. And also one doctor prescribed me for, doctor, what's the name of the medicine, other medicine for the pneumonia?
Hydrochloroquine.
Hydrochloroquine. So the other doctor asked me, if you don't have any breathing problems, so don't take this. So alhamdulillah, with the Zithromax and with the total rest, I'm sitting in this room last 3 weeks. My brother is like my mother. He's not letting me out for even only for bathroom. So he said, just stay home. He's cooking for me because his wife is also in another room. She have corona, and mashallah, he's serving. He never cooked in his life. Now he's cooking for both of us. So one day he just give us food like give it to the prisoners. So alhamdulillah, I am a prisoner, but still I am doing my duty. Alhamdulillah, as a journalist, I am informing the people. I'm just researching. Alhamdulillah, my TV from Pakistan, there was millions of people they watch, and I'm getting the information. But one thing I shared before you, I want to share again, the positive news. When I was in quarantine, because I can't walk at the time, I can stand. I'm praying. I was very hard to pray for me. So the good thing, when I was watching something, I was talking to you guys, and then I feel like myself is good. But when I was reading the news, and I hearing the news about the community leader, they are past, my friends, my community leaders, next day they are dead. So I was really afraid. One day, I told you, I received a call about one brother is 59 years old and is 6 years younger than me. He died while he was sleeping. 2 days, he have only 2 days illness. At that time, I couldn't sleep all night. I told my brother, and I want to write the will. He said, just go and stay. Don't worry. I said, no, because I have same symptoms. I have, 102 fevers. And so what I want to realize is positive. We should give the positive news as a journalist. So how many people are, we cannot, we have to inform what is going on, but also give the good news, the good side. So because now as a research, they say if you are hearing the bad news, your immune system will be collapse. On if you're hearing the good news, talking to good people, so your immune system is going to be increased. So I want to end on this because it's illness. What I think it's blessing for me. I mean, it's really, really blessing for me. There's two things. Number one, I want to change myself, and I want to be a better person before I was, because I realized, you know, people, you're sitting with you, tomorrow they are not with you. Maybe could be happen with them. So
Thank
why
you,
we are
Mohammed
fighting?
Bhai. Thank you very much. I know we have a little time
Yeah.
constraint, and we have so many people still waiting. So I'm keep bringing other people.
Thank you very much. Yeah.
Thank you very much. Mohsin Bhai, you would like to speak? 2 minutes you have. Do you want to speak something? Mohsin Bhai is fighting Corona at the different locations. He is another journalist, and his experience, I think, is better than all of us. Like Dr. Zubair is facing patient in the hospital. Mohsin Bhai and Mahviz Bhai, these are the people who's facing actually at the sites. Mohsin Bhai, if you would like to share a few words, please.
Thank you very much, Sam Bhai. Can you hear me good?
Yes, we can hear you.
Okay.
Yes, mashallah.
So this is a very good news that Mahviz Siddiqui, my great friend, is getting better and recovering. And I agree with him that we should also give good news to our readers, to our listeners. But at the same time, the scary news, to some extent, I think, work very well. Due to these scary news, people confine themselves at homes, and they are staying at homes. So the main reason we extensively report on not good news, just to let our community know that this thing is monster, and you know, you have to be careful to all the extent, because that's the only thing that is working so far, number one. Second, due to limitation of time, I just want to take the advantage and have one question for Deborah, that testing is okay. We know that testing is being done in New Jersey, but the feedback we are having from our community is that people are going to testing sites, and if you don't have any symptoms, they said there are no symptoms, so they are not being tested. So I have a question that people who think they have some kind of a corona and they don't have symptoms, are these sites are being taken these kind of persons or not? Second is testing is free. We know Governor Murphy is saying again and again, people does not matter have insurance or not, does not matter have any kind of a legal status or not, they go for testing and everything will be free. People who are going to hospital and getting treatment, they are asking questions, and they are asking that would there be any bills they are going to receive later on if they recover and come back to home. And third, as an ethnic media, can you share with us or with Sam Khan, contact person to who we can approach with regards to any information with regards to the COVID-19 cases in New Jersey? There are so many questions. When we are doing a story, we need to have some kind of information. So if you could share some context, that would be great for us. Will be great for us.
Do you want me to answer those quickly?
Yes, please.
So on testing right now, unfortunately, the state is still only able to offer tests for symptomatic people. And that is because there is not adequate either access to the front end part of the test or to the back end. And we are still rather glutted with lab results taking a lot of time. So that we are making that triage decision at the front end. It's not ideal. It's not where we want to be, and it's not where we're striving to be. I have heard of a couple of locations in South Jersey that are going to begin to try to test everybody if they have access to the test, anybody who wants it. But at this point across the state, symptomatic people who get a prescription from a doctor will be able to go to one of the testing sites. All of the public testing sites are listed on our covid19.nj.gov website, and you can find the testing sites, their hours, the requirements. Some, if they're county run, require that you show that you proof that you live in that county. But it is only for symptomatic people, and we do understand that that is a challenge and not ideal. In terms of hospitals, once you're in hospital care, they will want to use your insurance, and things are being billed through insurance as they normally would be for any hospital treatment. So besides the testing itself, there is no other right now waiver of cost for treatment. As always, though, we are committed to treating every patient who needs it, regardless of their insurance status. And on the third part, what I will do here in the chat box is post my email address so that anybody who has questions should be able to feel free to reach me. And depending on what the question is, I can direct you to one of my colleagues. I will say that our website, which I'll also put there, is extremely detailed. Our daily dashboard will give you the numbers, including breakdowns by counties of all the tests, of all the positives. You can find all of the information with respect to our executive orders, et cetera. And there's a very good search box on the general page. So there's a lot of answers to be found there, but we remain absolutely accessible to you to provide any answers additional to that. So I'll leave my email here.
Thank you very much.
Thank you very much.
If you can text me, though, I can type it in the email so they can have it. Since we talking about the testing, and in the tri-state area, people, even the government officials saying it's easy, but when we come across and meet people, they're still finding difficulties to go out and find the testing. And no matter what you say, on the ground, there is a problem for testing. And for that reason, we have one of the representative of Mr. Brother Anwar Qureshi. He is the one of the director in Sunrise Diagnostic, which they recently start. I think these are the second lab they started doing the testing. They have a center started in Newark, and with the help of Mayor Brad Cohen, we will be starting on Monday or Tuesday, drive-in facility, drive-in, so people can come in. And they already, we're going to be advertising it on different mayor's website, and we will request Deborah if she can help us. So our purpose, and in conjunction with the Pakistan American Council, Sunrise Diagnostic, they're helping. They're not only taking the people which have insurance. In some instances, if you don't have an insurance and you cannot afford, so we are working with them and they are helping us out. So I will ask him to say a few words about the current scenario.
Sam, thank you so much for creating this platform and inviting all of these esteemed guests, and including myself. We sincerely appreciate it. Let me just tell you a little bit about us briefly. We are a full reference lab based out of South Plainfield. We also have a toxicology lab in Irvington. We're part of the healthcare group, which is known as Sunrise Group of Companies. Over the last 1 month, my team has worked very day and night literally to get this lab up and running. Right now we're doing what's called Farooqui SARS-CoV real-time PCR test. It's in the first line of defense, and the idea is that if you take this test, we can contain the virus. The back end, I believe someone else had mentioned, that's the test that's going to test the antibodies to make sure that you're able to get back to work or mingle with people again. That would be the next step. We're gearing up for that as well. I believe in the next 2 to 3 weeks, we'll be ready with that. The way we collect the samples right now is through the nasal passage or the oral. Our capacity right now is roughly 1,900 tests a day. Every week we're adding equipment and staff to basically scale up. We've partnered with several municipalities, including New Brunswick, North Brunswick, which Sam introduced us. Today we did the first responders in Irvington. We're going back there on Tuesday, and we have set up in the municipal court. So we're testing all the first responders. The important part is, a lot of people are taking it still too lightly, unfortunately. Just alone today, I think I was on the phone with over 150 people at different times. They're like, oh, I don't have anything. Oh, I'm just this, I'll be fine. I'm like, hold on 1 second, guys or ladies. You have to take it seriously. If you have the symptoms, please go to the doctor. There are doctors available. You just have to look for them. Contact your local physicians. They have set up telehealth. You can go and see the doctors. Labs are available. One of our facilities is set up in Newark. It's at 155 Mount Pleasant Avenue, which is one of our clinics. It's a mental health clinic, but because of the social distancing, we had to shut it down 2 weeks ago. We have converted the whole facility into a walk-through testing specimen collection site. We're taking appointments, and we can get the results back in right now between 24 to 72 hours. As we scale up, I'm sure we'll face the same challenges as others. However, because the way we're gearing up to scale up, I believe we'll be able to maintain, at least for the foreseeable future, 72-hour turnaround time. Would love to work with any and all of you to see how we can get more people tested. Testing is the key. Once they're tested, we know what to do with them. Not only now, but what's going to happen is as these treatments and vaccinations come out, I'm sure the people that are tested early on will get consideration to have those medicines available to them. Samba, if you can please share my contact information with any and each of the individuals. Anything I can do to answer your questions, to get someone tested, we're willing to work with anyone right now. So thank you so much. Any questions, please?
Let me, we have whoever just joined us, I'm gonna introduce you all our viewers. We have a webinar, created this webinar for community awareness, what exactly happening, what we're going through, and how can, within the community resources available, we can utilizing those resources and we can help each other. In that regard, we have different panelists today with us who was talking about different availability, different scenarios. Dr. Zubair with us, he's a pulmonologist. He have a 70 COVID positive patient he's dealing with right now. And this is what he's going through, 7 days working. And even he is, so many times I ask him to talk to the patient at home, which they think they are positive. So I think he's doing a great community service. Shanti Nara, he's a freeholder, Middlesex County, who does handle the public safety issues. We have a representative from the lab, Sunrise Lab. We have a liaison from the governor's office, Deborah, with us, and she was sharing what is the governor's wants to improve the situation and how the community needs to work with the with these authorities so we can eliminate this scare what we have within the community. Then we have Nancy Pinkin, who is a state legislator, and I think within next few minutes, Congressman Frank Pallone will be joining us, and he
Sam,
will
I'm on the phone now. Sam, it's Frank Pallone. I'm listening.
Oh, you're listening. Okay, good.
Yeah.
Okay, so then we have, beside, since it's the Pakistan American Council, we have from Nosheen Jaffrey from Pakistan, who is in this crisis, decided she's one of the director of marketing head in Nestle. She worked for, she's, beside the professional work, she decided to serve the community. Now she have served in Pakistan around 3,000 families, provide the 1 month groceries. The people who is out of job, who cannot go to work. So these are our panelists, and I will take this opportunity since Congressman Frank Pallone with us. Frank, if you would like to come join us and share your authority as well as what the federal government can do for us, how can you help?
Well, I'm going to, first of all, let me thank you, Sam, and also Dr. Zubair for putting this together with the Pakistan American Council. And of course, I hear the freeholders and Nancy Pinkin and others are on as well. I just wanted to take a few minutes. I mean, look, I could talk forever and I'm not going to. I want to just talk about a few things that are happening right now on an individual level that are important. And then I just wanted to talk a little bit about the healthcare and what's going on. So probably the most important thing individually that's happening as we speak is this week, the federal stimulus checks to each, to individuals and their dependents started to go out. It's $1,200 per person, $500 for a child. And then if your income for an individual is $75,000 or for a couple, 150,000, it starts to go down to, and then eventually you don't get anything depending on how high your income is. But up to 75 for an individual, you get 1,200. Most people should get those checks deposited into their banks directly if they file with the IRS. But if they have problems, they can go on the website, which is irs.gov /coronavirus, irs.gov /coronavirus for more information. The other thing, of course, is unemployment insurance. You know, a lot of people are out of jobs, people that have never collected unemployment insurance. And what we did is, in the last bill, we really expanded unemployment benefits. So if people apply, they get an additional $600 per week over and above what they normally would have gotten per week until July, and they get an additional 13 weeks of benefits. So whatever you would normally get, it's bumped up another 600 and it's extended for 13 weeks. I know some of you are probably wondering about the SBA, the Small Business Program. Unfortunately, that's run out of money. But we are in the process of trying to pass another bill that will provide another $250 billion for that program. So if you've already applied, you won't have to apply again. But once we pass that, and I don't know when that'll be, hopefully sometime next week, then that'll open up again. The main thing that I wanted to talk about, though, was some of the healthcare provisions. As you know, well, I don't know if you know or don't know, but what we did in the bill, the last bill, the big bill, the CARES Act, is we said that anyone who goes for a test or the doctor that provides the test is free. What I mean by that is if your insurance doesn't cover it because you're underinsured, or you have a deductible or a copay, or if you have no insurance, it's covered. And so we don't want anyone to not go and have the test. Now, in the next round, next bill, we're trying to expand that to include treatment and drugs and the vaccine that we ultimately will establish. But that's not the law yet. Right now, the free is the test, and the doctor that does the test that's free, not the treatment. That we're hopefully will do in the next bill. Also, the main thing that I wanted to mention too, because I know there's probably a lot of doctors there, we set up this hospital healthcare fund that it's not just for, to basically reimburse or provide additional funding for hospitals or for providers. So it's a fund that started putting out money last Friday, a week ago, to hospitals, nursing homes, physicians. But unfortunately, in my opinion, the initial pot of money was based on your 2019 Medicare claims. So if a physician or a nursing home or a hospital had significant number of Medicare claims in 2019, they were automatically given a certain amount of money to reflect that. It was not, however, based on the number of COVID-19 cases, and it was not based on Medicaid. And so the next round of funding, which hopefully will be next week, will be more dependent on Medicaid and on states like New Jersey that have a number of cases. So again, look to that. Once that comes out, and we'll be on my website, which I'm going to give you. Once that second pot of money is released next week, it's already appropriated, it's already part of the law. You would then have to apply, whether you're a hospital, a doctor, a nursing home, whatever, for that, based on your Medicaid claims or based on the number of COVID-19 cases that you've handled. So I can't tell you anything more about that now because I don't have the formula and the applications are not yet available, but that money has been appropriated. And so once that comes out, we'll be able to give you more information. And we are also trying to double that fund from $100 billion, which it is now, to another $100 billion. And hopefully that'll be part of the next bill as well. I don't want to keep going on, Sam and Dr. Zameer, but I just want to, I want to thank all of you who are involved as healthcare workers, whether you're doctors, nurses, whatever you are. We really appreciate those of you who are in the front line, EMT. We really appreciate those of you who are on the front line. And you know, my office is not open to the public, but we're open online, and we're also open by phone 9 to 5, Monday through Friday. And I just want to give you those that information again. So the New Brunswick office, which is for Middlesex County, the phone number is 732-249-8892. I'll give you the Monmouth office, although I think most of you are probably closer to New Brunswick. The Monmouth office in Long Branch is 732-571-1140. Again, we're open 9 to 5, Monday through Friday. You just can't go there. And, you know, we have my website, which is pallone.house.gov, G-O-V, pallone.house.gov. You can email us directly on the website by clicking contact and email Frank. On the website, we have all the state and federal, you know, sites and portals for all the things that you might be interested in. We also have our Twitter at Frank Pallone. So I'm going to leave it at that, Sam, and thank you for allowing me to participate.
Thank you, Congressman. I think Congressman, he's just a phone call away. So many times I bother him for small things. Last week we had a problem with the Sunrise Diagnostic. They were having an issue with the kit was stuck at the port, and FBI was holding that. So I called personally him, and he called the offices, and it was really help. So our community, especially New Jersey, is a community where all, even though the authorities, the community members, the Indian community, the Pakistani communities, Hindu, Muslims, Christian, Jews, we all work together as one community. That really does help. What I'm going to say, Congressman Frank Pallone, for thank you very much for joining this thing. We're going to have this continually. We're going to have every week until this crisis is over. And this is a grave situation right now our community is facing. And we have one of Sabina Mahmood. She does a lot of work for the community. Sabina, you have any question?
Yes, actually, I just wanted to ask, and this can go to Nancy or Deborah. I know that there's other cash assistance programs available besides the stimulus fund that's coming to everyone. I believe a lot of people have received it. A lot of people have not received it, and there's a little, they're getting a little confused on whether they'll get it or not. And I know those questions are available online. My question here is those who are facing enormous financial issues right now, are those programs taking place, such as SNAP and the cash assistance programs? And are people able to access those? Do those still have funds available for people? I know that a lot of people, of course, are passing away. So funeral services, where can they go for all these other assistances that are needed at this time? Thank you.
Yes, who wants to take that question?
Nancy, do you want to start? Do you want me to? Oh,
well,
okay.
I could say the SNAP program, you know, is a federal program, and that's still available. We've actually provided a significant amount of money for the SNAP program. So, you know, if you want more details about that, I mean, there's an income eligibility for SNAP. You know, we used to call it food stamps, but it's the same thing. And also, we provided a lot more funding for food banks as well. So if people want to learn more about the SNAP program and how they're eligible for that, you know, they can contact my office, Sam, or they can go on my website and they can get information on SNAP eligibility. I don't think we've changed the eligibility requirements for SNAP, though, but a lot more people probably fall into it because they've lost their job or their income has been reduced, and we provided significant more money for it. But I don't think the eligibility for it has changed. It's still income-based, but you may fall into that category now because you've lost your job or your income's being reduced.
Right. There is, you know, people can go to food banks. Also, there are a lot of food banks providing food. There is one issue with the SNAP in that you can't shop online with SNAP. So if you can't get out to the store because you're ill or because you just can't drive or, you know, whatever reason, there's really not a way to purchase anything electronically. It's something that the Department of Human Services is looking at, but the computers just have never been set up for that. So that's something that they're they're looking at. As far as the burials, I don't know of any service to get free burials. You know, we have like Potter's Field, you know, for people to be buried, but I don't know of any funding source. I can look into that. I had looked into it once before but it's certainly a good issue, and we have so many deaths that I'm sure it's very relevant right now.
And can I just say, Sabina, I can tell you in Middlesex, but it's certainly, I know, probably available in all the counties, but if people go to Middlesex County, nj.gov, we've created a portal that leads you into just COVID-related issues, and some of it relates to social service issues. So if people need to apply for benefits that they've never applied to before, people who are already receiving those benefits have questions, they can receive guidance and information on how to do things. One of the other things I will say to you is, Nancy was just talking about if you can't leave your home, but I know in Middlesex County, in just about every single one of the towns, there have been amazing efforts made, and there are different groups coming together, and I know that there are from churches and mosques and temples, along with other social groups, we're making great efforts in most of the towns so that we can take care of our neighbors. So one of the things I know is that our South Asian communities aren't so used to asking for help, right, outside of the direct community. But I would encourage people to contact their local municipalities, because all the towns have lists of different groups that are working together to help make up any deficiencies that people are having right now during this crisis. When it comes to things like food, especially food insecurity. I know that in a lot of the towns, the school systems are delivering food to the children. And in my hometown in North Brunswick, it's not just the children, it's for the parents too. So if people show up, there will be breakfast, lunch, and dinner for the kids, and then the parents can get food as well, and also at the local food banks. Middlesex County has a large food bank, which we then supplement. It's called McFoods, and then we supplement all of the food banks throughout the county. So there are things available. I wish I could say that that all of the government programs are flush and full of money and resources, but they're not right now. And so where we can, local charities and local social groups are helping to fill the void.
Yeah, and I would say, as Congressman Pallone said, you know, call any of our offices, even though they're not physically open. People are answering the calls every day, and we have a whole list of resources, and we'll talk, you know, connect you wherever, you know, it is that you need to go, whether it's the county or the state. And we have calls all along with each other just to kind of update on what's happening. Same thing for unemployment, same thing for any of the federal benefits. And a lot of the business associations have been having really great conferences on and helping people with how to apply for any of the aid that is available. And
Thank you very much.
The governor's site also, COVID-19 site, is a very good site that has a lot of information as well. And it also has a wizard, like for business funding, you can go in there and plug in your information and it'll tell you if you're eligible for things or not. Very easy to use.
Thank you, Nancy. Thank you. One more thing, let me once again so introduce you guys. So we have amongst us Consul General of Pakistan, Aisha Ali. She joined us and she will be discussing the issues we have within our Pakistani community. Every community, they have their own issues. And I will bring her in later. And before we moving forward, I would like to introduce our panelists. We have Mr. Nadeem Qureshi. Within our Muslim community, we have an issue right now about the burial, how we're going to bury them, how we're going to give them a shower, which is called ghusl in our language. This is a major problem, and we never seen this in our decades and in our lives. This is the first time in the history that Muslims seeing that they can bury their loved ones without even giving them a shower. So this is for that reason we have bring us And one more time, we have a corona patient. He has currently 70 patients. He was talking before. I will bring him in. We have a Governor Lejan, Deborah with us, and she was talking before. We will get some points clear after this. We're going to have a Q&A session. And we have thank you very much for our congressman. He joined us from Washington, and he was discussing and showing. Among us, we have one of a CPA, Deepak Malhotra. He will be discussing about what other options available for our community to take the advantage in this crisis situation. Nancy Pinkin, our county legislator, Anwar Qureshi from Diagnostic, Sunrise Diagnostic. We have Shanti Nara. She's our county legislator. She works in human services and safety, and she's a very active member of our community. She always there for the community. So let me go back to, we have a Noshin Jaffrey from Pakistan. She's doing a lot of community service. I will request her to share her experience, what they're facing, what they're doing. Noshin, can you hear me?
Yes, I can. So hello everyone, good morning from my side and good evening to all of you who are in the evening time now. So I'm very happy to be part of this forum. It brings a lot of visibility in terms of what global communities are doing, what you guys are facing in US. In Pakistan, I'll just brief you on the topic in terms of how big the issue is right now. So we are a population of around 220 million people, not very literate in terms of our rural population. So overall, the literacy rate would be around 24%, which means not many people are even aware of what the issue is about. And just telling them on the basics in terms of hygiene and educating them on how they have to take their care is a big issue in itself to begin with. So if I talk about the numbers, so overall, the positive cases which have been diagnosed in Pakistan for COVID-19 are around 7,000. The people who have been tested so far is 80,000, which means out of 210 million population, only 80,000 tests have been conducted so far. Yes, one of the biggest issues we are facing in Pakistan is our quantum of testing which we are doing on the daily basis. So roughly on daily basis, we are now capable to do 6,000 plus tests, but we started really, from hundreds, and now we have reached 6,000 plus tests, which is a good progress. The very good thing is that government is taking it very seriously. They are educating people. They are making sure every nook and corner that people are aware of the fact that it is not something which they have ever seen in their life, and they need to be very, very conscious about it. So as we speak, I sit in Lahore, which is the federal capital of the province of Punjab, the most thickly populated province. We are in a lockdown phase till 30th of April. Like many other cities of Pakistan, there are, just like Nancy and other people mentioned, in terms of how they have, given breathing space to some of the industries and some of the areas. But still, I think it is a very tough lockdown situation, and people are really suffering. So as far as crunch is concerned, there's emotional crunch, there's an economic crunch, and there's, the biggest area which has suffered is the daily wager. Because of illiteracy and because of the joblessness in Pakistan, there are a lot of people who are dependent on their daily wages. They don't have savings. They don't know how the day would come up tomorrow. So they set up their day according to what they get to earn in that particular day. So if I talk about what my role has been so far, so as Sam mentioned earlier, I work for Nestle Pakistan. That's my full-time job, and like most of you, I'm working from home. So it becomes, it's a torture in itself, frankly speaking. But in the meantime, what I was able to recognize was that the village where I come from, that village has roughly 700-800 households, and most of the people are daily wagers. Lot of efforts are being done in cities, but what I realized that in the villages, the effort is slow or staggered. That's why the target audience which I picked to help was my village to begin with. And then we have now, mashallah, expanded to the villages which are nearby our own village. So the frontline soldier in this case is my brother, my younger brother. So one of the tough decisions we took, that my mother and myself, we stay in Lahore, and he goes to our village and lives there for some time, stays there in our family home and help people over there. So I was raising fund. It was my first time, frankly, and I've not done anything I've not done anything of this quantum before. So I'm very happy to share that along with Pakistan American Council help, uh, and 90 other donors, which I was able to have through my friend circle. When I started, I thought that I would get at best 5-10 people contributing, and I'll be able to help 10-15 families. But I'm happy to report that I've covered more than 1,000 families as we speak, for 4 weeks of ration. So one ration bag, or the necessity bag, I would call it, for general public, um, has the value is around $45, and we have been collecting funds based on that particular amount. So now, the moving forward, the biggest challenge we have is our holy month of Ramzan is coming, and again, something which has not improved in terms of the daily wages is they going back to their workplaces. So now I'm raising fund to make sure that I refill these families, and I try to expand the scope as much as possible. So yeah, I think one of the panelists talked initially about hope, that we should give hope to people. I think that is very powerful word, because if you don't give hope and you do not tell them, or you do not help them seeing the good side of the picture, that people are recovering, the government is trying their best, and they need to contribute to the effort, which means they need to stay home, because it matters not only for them but all of the community. I think these are few things which I would like to encourage everybody talk around in their families, and in their friend circle, and this is how we can have this snowball effect moving forward. So yeah, that's all from my side. If you have any questions, I can take them.
I was mute, sorry. Thank you. Thank you. I will go to now Dr. Zubair again. We started conversating in the beginnings. Now I think everyone is watching. Dr. Zubair, would you like to shed some points of what's happening and what can we do as a community, and what is your role in this situation?
Thank you, Sam, and also want to thank the community and all the panelists who are giving us time today. Just going back a little bit with the background, coronavirus 2019 is a corona family which is discovered this virus particularly in corona family in 2019. That's why name is COVID-19. So this is new to the community, new to the patient, new to the physician, and then new to the whole world. Being this virus new, we do not know enough about this virus. And this virus is very communicable, and that's why we're seeing the devastating result of it. I think going back in January and February, we were very relaxed, did not get to bottom of it, that what's going on in China and then what was happening in Europe. And as a physician, I can tell you, we did not learn much from the China and European experience, especially how to deal with patient. First 4 weeks in America, we were doing things what Chinese and European experience was, and I can tell you that we didn't get anywhere. Now, we decided as a clinician that we're doing and treating these patients the way we think these patients should be treated. Yes, there's no cure at this time, but we do supportive care and help this community. I want to stress a few things to the community is how we can beat this virus or stay ahead of this virus. Why the governmental office and the community leader is urging the community to stay home so we can really stay ahead of this virus by not communicating and stop the spread of this virus. That's the only way at this time we can beat the virus, because as I said, there's no immunization and there's no antiviral medication at this time we have. Imagine the patient when they come to the hospital with the full-blown symptoms, then if you don't have the treatment, you don't have anything to treat with, what will happen to the patient? I hear again and again the hope. I think hope is there, which we as a community already proven that if we can stay isolated, quarantine people who are positive, we can bend the curve. Curve bending is a kind of very important word. As a clinician, I can tell you, we were getting admission 50 to 70 patients a day, half of them ending up in intensive care unit. There's no enough intensive care bed in the hospital or even medical surgical bed in the hospital. Imagine if we go to the level where there's no bed in the hospital and the patient who are sick cannot breathe, we just close the doors on them. Imagine how it will feel to the community and what will happen. Our hands are up against this virus. And I think leadership, especially in New Jersey, Governor Phil Murphy, by taking certain community part and talking to the community and isolating them, we were able to really get to the peak and curving that peak a little bit. Yes, there's still a lot of patients coming to the hospital, still a lot of people going to ICU. People who were admitted 10 days or 12 days ago, many of them are dying. Mortality in that population is very high who ends up in the hospital. That's what I see. I see people who are admitted in the hospital. Those are the people, that's 10% people out of the 100 patients who are affected, 10% who end up in the hospital, mortality in that population go up to 4 to 5%. And that's devastating. So what we can do, quarantine ourselves, stay at home, try to avoid crowded. So other thing which I want to bring to the attention to the community is where we get who we get affected from. It's mostly people we know. We don't get this infection from strangers. Right now in New Jersey, cases happening at your work, at your home, at your relatives' family. Who bring it to you? People from New York who are working abroad, people who are on front line working, people who are healthcare. There's almost 9,000 healthcare people are affected right now.
Dr. I'm going to stop you there because I need to get some other people in. There's so many people in. Thank you very much. Dr. We will get you back if time allow us. Congressman, are you still there?
I'm here, and I looked it up while Dr. Zameer was talking. I have the website, if you want, for SNAP that you can apply online or ask, get some information about the benefits if you just want me to read it. You want me to read it?
Yeah, sure.
SNAP?
Please.
This is the state website. It's nj.gov/human-services/NJ-SNAP. So nj.gov/human-services/NJ-SNAP. And if you go on that, you can actually fill out the application online and it'll give you the eligibility for it.
Thank you, Congressman. Congressman, I have a question just came in that people saying that it looks like today we have almost 750,000 people are most likely positive. And it doesn't seem like it's going to go away within weeks. It's going to take time. So whatever the fund we're receiving, the people, single family, the or married couple, they're getting $2,400. So in case if things get worse, so is there anything else in the pipeline for the future? Because this $1,200 people, the money is not going to help. Number one. The second question was that there's so many subcontractors. This country built on small businesses, some moms and pops stores, some of the small men, because I'm a general contractor, I'm a builder, I deal with so many subcontractors with their cash, they have a lot of dealing in cash. They don't have a W-2, so they cannot go for PPP, so they cannot apply for that. So, and they have been working very hard. They're active members of the community, working diligently, working very hard for their monies. Are they going to get some kind of help from the government? And what's the plan for the future if things get out of control?
Well, you're asking a lot, and so I'll try to be talk in general terms, but I think that really, if people have individual problems, they have to contact my office, because it's hard to be, answer your question in general terms, Sam. But what I would say is this: whatever I talked about, whether it was the cash assistance, whether it was the food stamps, whether it was the hospital fund that doctors can provide for, whether it's the small business loans, which are, forgivable loans, all these things, as they run out, our intention is to refill them. So, we are we expect that the SBA money will be refilled and people can apply again. We're hopeful that there will be another cash benefit. SNAP keeps being refilled. So all these things, if you hear that they're running out, or someone says, needs more, they can always call us and we'll look into it. And I do believe that Congress will continue, if this continues unabated, and we're going to try to, renew these funds. But I'm telling you what exists now. I can't promise, what might happen in 2 or 3 weeks, because, Congress has to pass the bill, appropriate the money, and that has to be Democrats and Republicans from all over the country. But I don't want anybody to think that, just because what I'm talking about today is not sufficient, that we're not going to continue to try to provide more money into these various programs. Now, when you talk about a contractor who's, you're saying somebody who's like totally off the books and doesn't pay taxes or anything? Is that what you're saying?
They do pay taxes, but as far as the payroll taxes, they have like cash. A lot of employees, basically Mexican communities and Hispanic communities. They have.
Well, look, I got to be honest with you. This Trump administration, as you know, is not willing. And I mean, I know I'm not supposed to be political here, but the bottom line is, the Trump administration and a lot of the people who are associated with him are not looking to help the people that are undocumented. And so that will be a problem. Now, it's not a problem in terms of their health care, because, as I said, if they want to have a test, or they can go and have the test, they can go to the hospital, they can go to a doctor, and that will be reimbursed. And I'm hoping that, down the line, we're going to be able to extend that free testing to free treatment and to free drugs and vaccines and the whole thing, because we're all in this together, and we shouldn't differentiate people because they're undocumented. The virus is not looking at whether you're documented or not, or whether you're a millionaire or you're a pauper. That's not the way healthcare works, as Dr. Zabeer and all of us know. But right now, in terms of healthcare for somebody who's undocumented, look, go and get the test, go to the hospital, the emergency room if you have to, go to the community health center. The Chandler there's the community health center in New Brunswick, the Rutgers one. These are all facilities you can go and have tests, and you can, get treatment. We don't want anybody to not go and take the test or not get treatment because they're undocumented. But in terms of cash assistance or help through these various programs like the SBA, the cash assistance, the unemployment insurance, no, they're not going to be eligible if they're undocumented. That's the problem. And I, as a Democrat, I would support expanding a lot of things to the undocumented, but it's not the case. It's not the law.
Thank you, Congressman. Thank you. I will take, I know we're getting late now. I will request, as I earlier introduced, we have among us a Council Journal of Pakistan in New York. Her name is Aisha Ali, and she wants to join the event, this webinar and discuss what the Pakistani community facing in the tri-state area. Please, Council.
Good evening, everyone. Thank you, Sam, for this opportunity. I'm very happy to be joining your webinar. I thank you for the wonderful work that you and your organization are doing for the community. It's really very, very commendable in terms of, going out there and distributing food and helping people in every possible way. Thank you also to all the participants. I think it has been an extremely informative session for me as a Consul General, because in our community, in the Pakistani American community, obviously, in the tri-state area, people have been impacted by this disease like the other communities, and people's livelihoods and their economic lives and their jobs have been affected by it. So very important, some very important issues are being raised here today, and I'm very grateful to everyone who has participated and shared information. I think as we deal with this pandemic and as we are, sort of incarcerated in our homes because we cannot go out, it is very important that whatever information we have, it needs to be shared. So thank you to all for sharing the information, particularly in regards to the economic situation and to the stimulus package. From the Consulates Forum, I also wanted to highlight a couple of steps that we have taken during the pandemic and in order to keep our community informed. So right from the beginning, when we started seeing the first cases and as we were becoming aware of the situation developing, I think the Consulate General has been very, very active in disseminating information and in making people aware of the guidelines that were coming out from the World Health Organization as well as from the local and the state governments. So in the first phase, I guess that was very important. And since the Consulate General of Pakistan, New York, has a very large jurisdiction, and we deal with a very large community of Pakistani Americans, we have been extremely proactive in trying to help and to coordinate our efforts with the community organizations and to help our community as much as possible. So here, for everyone who is listening to this webinar, I want to highlight a number of steps that we have taken especially to deal with this situation. We have, for everyone, I want to tell you, a 24/7 emergency helpline at the consulate. So anyone who needs any information or needs any help from the consulate, we are available 24/7 to respond to your queries. We have designated a special focal person and a special team to address people's concerns, whether it is related to COVID itself or whether it is related to the situation resulting from it. Here, I would also like to share that we have a number of our Pakistani citizens who are also stranded in the consular jurisdiction as a result of the suspension of flights to Pakistan. So anyone who is listening to me and needs help and any assistance in regards to that, we are available to provide all sorts of assistance to our citizens. And our information is available on our website, our phone numbers, our email addresses, how to get to us through social media, Facebook, and all other social media platforms. We continue to offer all our consular services to our community online. So whether it's passport, visa, whether it is their national identification cards or any other consular service, it is still available online, and you are all requested, if you need, to get in touch with us online for those issues. We have been extremely proactive in the last couple of weeks to ensure that our communication with our community remains really updated, and we're active. We reach out to our community through our direct phone calls. I have myself sent out several emails, written letters, as well as recorded messages in order to address the needs and concerns of the community. We have also reached out to the families that are affected by COVID-19 and any assistance that they need in regards to the burial of their loved ones or repatriation, in some cases, of the dead bodies. We are there to assist you and to help you. We will offer support for funeral expenses if required. And in our larger reach out to the community, I am holding very regular town halls on online through Zoom and other services, so that we keep informing our community of the important issues that they are facing in this situation, including the economic situation, as well as how to deal with the stress and economic and emotional stress. We are being helped in our efforts a great deal by several Pakistani American organizations and community leaders. Sam Khan, I'm very grateful to you for all your efforts and for all your assistance to the consulate. And if anyone is listening to me and needs any assistance, you have all our information. And I would request you also, Sam Khan, that if somebody approaches you, if you could kindly guide them. We are available, we are working, and we're working round the clock to help our community. Thank you so much for this.
Thank you very much, Aisha Ali, the Consul General of Pakistan. She was explaining what's the situation within the Pakistani community. And there's a one journal, as Frank Malone, Congressman, said, this corona doesn't discriminate against. We all discriminate against each other, but this guy does not. So I have people here. Sunil Hali is one of journalists and from the Indian community. We have a Deepak Malhotra with us, and he will be expressing some. He will be mentioning some what the government is doing when as the finance comes to the community. How can they improve their situation currently they are facing due to this COVID-19. Deepak Malhotra Saab, he is a CPA. Please come on and speak.
Thank you, Sam Bhai. It's an honor to be here, and thank you so much for hard work, all those frontline doctors, and thank you, Congressman Frank Pallone, Ms. Pinkin, and all the leaders of the community, Shanti Narat, for doing all the every great thing for the community. I'm not going to take that much of time, but Sam, thank you for making me part of this great program and all the things that you have been doing for the community. So the government, as Congressman Pallone mentioned, that we have some economic impact payment from the government EIP stimulus checks. It already has been deposited on some of the accounts, $1,200 for each individuals, and there's the income limit for $75,000 for single, and married filing jointly is $150,000. And it completely phased out when somebody makes $198,000 or more. So 150 to 198, they're getting some payment, but not actually 2,400 for like married filing jointly, getting a little bit lower. And also for each dependent children, they're getting $500 for each dependent qualifying dependent. So the qualifying children has to be 17 years or younger. So there are some miscommunication going on. There people are panicking, but and the checks are being deposited slowly. The other thing also I want to advise everyone here: if somebody is not eligible on 2018, but they are eligible on 2019, so just make sure they file their return as soon as possible so they can get the stimulus payment or the same 2,400 for married filing jointly and 1,200 for single. And anybody who's not eligible on 18 and 19, they can still get in 2020 when they file 2020 return on 2021. So that's another thing, but that's not basically anything. But there are a lot of credits, and I also gonna cover in short, not too much. There are student loan payment has been deferred, totally stopped. The government is not collecting the self-employed sick leave credits. It's a huge benefit for self-employment people. There's up to $10,000, $5,110 maximum credit if somebody is self-employed and they are staying home and if they get affected with COVID-19. And there's also 2,000 credit for if somebody's self-employed and they're taking care of the child at home. So there are a lot of good credits available, but that's not a cash program now that anybody can get advantage, but eventually, yes. The net operating loss, NOL, for corporation also can carry it back for 5 years and also can carry it forward now 100%. That's for only C corporation if anybody has it. For self-employed, I'm sure the PPP loan and then EIDL, most of the people now know that, as Congressman Pallone mentioned, they ran out of the money. And thank you for all doing, Congressman Pallone, to get this another funding is sure is going to be there. So just to let you know, guys, it's a great program. Just talk to your banker, apply for it. SBA is on, kind of a very helpful on those things. So just please make sure your paper's ready. It's basically forgiven for the people as long as you have a 75% of the payroll on the money that you borrow from them. There are two separate programs, by the way. You can apply for both. Some people say, hey, you cannot apply for EIDL and also PPP, but you can apply for both. What will happen eventually that if you get EIDL, that's a non-forgivable. But if you have employees, eventually you can transfer that portion to a PPP program, and that can be forgiven. The EIDL has 30-year payback, and the PPP is only 2 years, but the loan interest rate is only 1%. If any money that are non-forgivable. So these are the great benefits. I would be happy to help. By the way, other things also people were confused. Let's say somebody has a parent or any dependent who are not filing the tax returns. They can go online in IRS website and they can register that they are not filing the return. They can still get that EIP payment, like a stimulus, $1,200 each. To their mailbox or bank account they can fill out. If somebody doesn't know, I can definitely help. And my also company website, I have that link. You can click it and then you can register your name that I am not filing 2018 and 2019 return, and you can be eligible for $1,200 payment for that. And as I said, there are a lot of other credits you could be eligible, and I would be happy to help. And Sam, thank you. And let me know if anybody has any question. I would be happy to answer if any way I could. Yeah, I cannot hear you, Sam.
I think we have passed our time limit, but I think this is very interesting. There's very interesting topics. And there was a very important issue within the Pakistani Muslim community, not only the Pakistani community, Muslim community. We having issues with how to bury a dead body, which is corona positive and expired in the hospital due to corona. We have with us Mr. Dr. Nadeem Qureshi. He's the owner of a park funeral home. So I would like request him to, Mr. Nadeem can say a few things in very short 3 minutes time. Thank you. You have a mute actually. You have mute your, you have to unmute yourself.
Sam, can I say something while we're waiting for him?
Sure.
I just want to say two important things. One is while we've been socially distancing, we still have to do the census, and it's very important for us to get funding back to New Jersey and to get funding for all of the healthcare and the other services that we're providing for people to fill out the census. So you should have found something there, or go to 2020census.gov. And the other thing, really quick, is that the primary election has been moved to July 7th.
Thank you, Nancy. And I'm gonna, I think you have to fix your, the mute button. I will take Tahir Raja. He's another organization who buries, if somebody dies and they don't have a funds, they bury, they donate and they collect the money from the community, and they're doing a great job. Please start by quick, if you can, just in 3 minutes. And you have a mute problem. Yeah, now you're good.
Yeah, Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, everybody. This is I'm pleased to join this forum. It's an honor for me from Pakistani community to represent my organization. So briefly, I will touch upon. I'm president One Nation Us. One Nation Us is basically a non-profit organization, and a lot of people were talking about the hope and community getting together. And we don't know how to fund anybody who's a needy case. So here's my organization doing the same. We have more than 180 volunteers on the list, and all members are basically volunteers, and they give their time and to the community. We are helping the community since last 5 years. And there are so many other projects we are running, but I'm not going to talk about that. I'm going to just talk about the funerals, which we are talking, which is an epidemic right now. So when a call comes, when unfortunately somebody dies, they call us. So we take the call, and if that family can pay the charges for their funeral, we assist them. We technically assist them, we guide them step by step, because seriously, when somebody dies at home or in the hospital, people don't know what to do. So we help them and we guide them, and we facilitate whole the process. But second and most important thing comes up then when somebody cannot pay the charges and there is a funeral now. So what to do now? So here comes the One Nation Us. When they call us, we ask them, are you going to pay? Or you cannot pay? So our evaluation committee, we have an evaluation committee, we evaluate the case and decide, yes, we're going to help it. So there's no worries for that family. We raise our funds from our own members. We have a group of WhatsApp, and we raise the money within our group. And we have, I told you, we have more than 180 members. Believe me, it takes minutes. And once we were talking about the positive things during this is one of the positive things that One Nation is doing, that in minutes we get the money. People have come together. People have gone more sensitive, and people are more willing to work together and help each other. So here is One Nation. So whenever there is anybody like that, we fund that funeral. And one more thing I will tell you, that One Nation does not accept any surplus on the donations. The moment, for example, we need $2,000 for their funeral, we just raise $2,000. And after that, it stops. And that money goes directly to the funeral home who is doing that burial. So I would suggest, I would rather tell everybody, I would tell Aisha Ali, the Consul General of Pakistan, we've been working with them actually, and we want, if there is any case, Nancy, you were talking about that we don't know how to support those families. So here we are. Take my number. One Nation Us number is 347-770 One Nation Us, ONUS, and that becomes 6687. So please write down this number. Anybody in this community needs help, we are open. We have a 24 hours call number. We have our...
Thank you very much, Tahir bhai. Thank you very much. Deborah, I think is getting late, so we're going to wind up. If you want to say a few words, end of this.
Can I just ask, Sam, did we find the answer about how the body preparation is being handled now?
Yeah, actually, problem is Nadeem bhai, he having a trouble with this mic situation. So I don't know. He's the one, the funeral guy. So I don't know.
Sam, can I add on to this one, please? Can I answer, Nancy?
Yeah, go ahead. Go ahead.
Nancy, there are two cases. One is doctor is sitting with us, Dr. Zubair. He knows better. There are two types of cases. One, that some person dies in the hospital, and the second case is when somebody dies at the home. So in the hospital, the case is very clear. Doctors sign the death certificate. They wrap the body into the bag. And then when funeral guys go, funeral doctors go, they pick up the body.
Okay, so I'm going to take, because Nadeem Crash, he is on. So please, Nadeem bhai.
Okay, thank you very much for inviting me for participating in this informative webinar. I just want to let you know that Muslim funeral is very simple, but it is a little different from the other communities. And our procedure is that we start after having a person die, we remove the body and bring it to the funeral home. We need to wash the body, and after this we have a quick short prayers called janaza, and then we go to the burial procedure, into the cemeteries. So this is something very simple, but at the same time it is very mandatory for some people from the community, even if they are not relative to the decedent. They have to participate, and this is called farz kafaya. Someone need to make this funeral services for the decedent, and after this, has to be also very quick. So that's something make our community very panic, especially in this situation, because we have to be very quick and we have to do all this, and we have to really participate. This is part of our religion. Now, in COVID-19 pandemic phobia, we're having a lot of backup from hospitals for removal to the funeral home to cemetery. Everyone is backed up right now. Families are very, very panicked in this situation. we are receiving 2 to 3 cases Muslim from New Jersey right now. I'm also having New York funeral home services, and we are having over there a lot more. But in New Jersey, we are having 2 to 3 cases per day. And at the same time, I want to advise everyone, please do not get panic at this moment. Everyone needs time. Let them to work, because we have to get the burial permits. We have to get all the EDRS permissions. Otherwise, we cannot make this burial. And at the same time, there are many agents who are working right now in the community, and they are collecting cash. I like very much careful, because if they collect the cash, you cannot follow them. You cannot get the services accordingly, because they are not funeral homes. So we need to really contact the proper facilities, funeral homes, like we have a Park Funeral Home, and pay with the credit card. Don't pay with the cash. This is something I really want to stress. And at the same time, when we are coming for the funeral services, we have to maintain social distancing, because we don't want to spread this disease, because COVID positive families, and we have a washing, we have a janaza, we have burial, but we need to also have social distancing. For any need, I will really like to call our number 718-418-7225, or go to our website parkfuneral.com. Any question, I will be very happy to answer.
Thank you very much. I think we're gonna just wind up the.
Sam, can I
yes,
just say 2 quick
I was
little
coming
things?
to you. Yes, go
Yeah,
ahead.
just 2 quick things. I just wanted to tell everybody, Middlesex County, we're the only place in the country, and I think we're the only place in the nation that started a spit test. So it is not the swabs, it's a spit test. It's much safer for the people coming to have the test, as well as the workers who are administrating it. And the results come within 24 to 36 hours. So we just started it this past Wednesday. We'll be doing it 3 days a week, Monday, Wednesday, and Friday, in both Edison and in South Brunswick in Middlesex County. Unfortunately, right now you have to be a Middlesex County resident, but we're hoping that as this test, we start doing this more and more, we can work with our partners in Middlesex to spread it around the state. And the second thing I want to say is there are a lot of people in our community who are medical professionals. And one thing that happened today that Deborah didn't get a chance to mention is the governor did something that we're the only state in the country that's doing, where they are going through a process where they're going to grant foreign doctors emergency doctor's licenses in an expedited fashion, so they can join in the fight against this disease and helping our community members. So that's just something that if there are people out in the community that you know who were doctors in Pakistan or anywhere else, and they're here and they haven't been able to practice, they can apply to the New Jersey government website and see if they can qualify for this emergency license. That's it.
They also provided protection from medical malpractice with this as well for the doctors that would want to come forward.
I just want to add something that Medicaid also pay for Medicaid recipients for the funeral cost. So funeral homes can also bill to Medicaid.
Back to you, Sam.
Deborah, you want to say something?
Sam, I just want to thank you and everybody who's participated this Friday evening. I see you've had a lot of people stay and listen in and chime in with questions. This is one of the most important things that we can do right now, is come together to share information, to support each other, to learn more about ways we can help and places we can access help. Everything that we have done that has disrupted lives, we're trying to do as many things as we can to help people's lives. So the partnership will continue. On behalf of Governor Murphy, we see that we have great representation from the community, from the state legislature, from the county here, and we're all here to work together to help people through New Jersey through this crisis. Doing it together, we know we will. And Sam and Dr. Zubair, this kind of event is exactly what really helps. So thank you all very much.
Thank you. If Congressman is still here, if you last minute, do you want to, we're going to end this now, if you want to say something.
No, thank you, Sam, and thank you to Dr. Zubair, but please don't hesitate to contact us for any of these questions. I really appreciate the fact that Sam and Dr. Zubair did this tonight, but don't hesitate. We're here, and even though the offices are not open to walk in, you can contact us on the phone or through social media. Thank you, Sam.
Thank you very much. I think we're going to be continuing this. We're going to try to do within the next 10 days again. And we will bring other expertise and other government officials to share, and maybe the things being changes. I hope things get better by the time next week or 2 weeks. What I'm going to say towards the end, the community is going through a crisis, and we need to, our resources, put it together. Like PP, if we don't have a mask, our Pakistan American Council, Dr. Zubair, I have 2,000 masks sitting in my car just for the donating right now. So I think from the Sunrise Diagnostic, they donated, I think, 30,000 masks to the governor. So we as a community, we working to even help lend our resources, lend our services to the officials, to the government, so they can resolve the situation. This is a grave situation. This is not the regional situation. This is a global situation. This is not just a pandemic. This is a situation we can turn the economy into depression. We already going through, you see our stock market, you see how many people applying for unemployment. So this is not an easy time on a government as well. So they're trying to help you, but you have to see where the economy is not working, where the people are not working, they're not collecting taxes, they are actually so many stuff going through. And our governor is every day on radio and TV, and he's talking about how can we, and towards the end, what I'm going to request everyone who's listening to this webinar is stay home. Don't be smart, and don't try to do something stupid. Sorry to say, but this is threatening. If you go out there and one single event can bring you the corona in your home, your kids, your family, your older parents, they can get it. So be careful out there. Whatever you can do to help the community. It is hard time to help the community, but we are doing ourselves. People like me, there's so many people like me who are doing good work for the community. Once again, thank you, all of you. Nancy Pinkin, our state legislator, Council General of Pakistan, Aisha Ali, Shanti Nara, the county legislator, Nausheen Jaffrey from Pakistan, she's doing a great service. Tahir Raja Saab from One Nation, Deepak Malhotra, one of our CPA, is a community activist. He ran for assembly before. Deborah, I always forget her last name, but Deborah. So we have so many other people. Once again, we will wind this up. Thank you, all of you. Stay safe and lend your hand to help others. Thank you very much.
Thank you.